Good morning and welcome to Your California Life. I'm your host, Aubrey Aquino. Hello, Tuesday. We hope your week's off to a good start. Thanks for watching YCL today. Muscle pain associated with grinding and clenching of teeth can be a real problem for many people who suffer from these issues. Dr. Andrea Joy Smith wants to help dental patients fix those problems and is here to talk about her modern approach to teeth treatments. Hello, Dr. Smith.
Good morning, Aubrey. How are you?
When we talk about the clenching and the grinding, I've fallen victim to that. But why does that pain start to occur?
This dental pain from grinding and clenching the teeth, it really comes from the muscles because what happens is patients are overusing and overcontracting those muscles. And as those muscles are overcontracted, they become very large and they also become very painful because we're using them for a lot longer than we are supposed to. Because normally when we eat, chew, talk, those muscles are not being used to their full capacity. But when you're grinding and clenching a lot of times over the entire night, those muscles are being overused.
So when you have your patients that come in and you're doing an exam, can you tell if they've been grinding their teeth, if that's happening?
Yes, often, many times, patients are not even aware that they grind. All they know is that their teeth look a little broken, their teeth are worn down, they have some muscle pain, they may have some gum recession. So, when I'm examining those patients, I'm looking for those signs, and then I also correlate that with what they're reporting as well. I sometimes have patients that just come in pain related to this problem, and they really can't figure out why their jaws hurt so much. But when I see those signs of worn down teeth, um, and gingival recession, I know exactly what the cause is.
Well, you said some of your patients may not know what's causing this or why this is happening until they see you. Are there symptoms that they can
Mhm.
look out for that may be a good indicator?
Yes, there are some symptoms that they can look for because this act is involuntary. Most people that do it are doing it overnight. So they can look for things like sore muscles, or if they wake up in the morning with headaches, or maybe all of a sudden their tooth has fractured, or a recent crown that they had placed has come off. Oftentimes, there are just those extra movements of the jaw that are causing the pain and also causing the teeth to fracture.
Well, I'm sure that can be very uncomfortable. So, how do you go about treating it and kind of getting a solution for these patients so they don't deal with any of these issues that are going on around their mouth?
Well, the most traditional way to treat it is with the use of a night guard, something to protect the teeth and also to keep the jaws apart so that that hard clenching and grinding cannot take place. That's the traditional way to treat it. But what we do these days is we use Botox. And what Botox does is actually weakens and relaxes and to some degree paralyzes that muscle so that the overuse and the overcontraction cannot really take place. And so some patients can't even tolerate a night guard, or they'll wake up in the middle of the night and it's thrown across the room because they are subconsciously removing it. And they wake up in the morning, they still have the same problem. So if that does become a problem, we can use Botox to weaken the muscles. And the Botox is working continually, and it does not depend on the patient's compliance to have the Botox work.
And this is interesting because when you think about Botox, you're not thinking about it as the answer to your clenching and grinding issues. Is this like a modern treatment? How do you like how it's working?
I love how it's working, and it makes total sense. Botox, everyone knows, is normally associated with cosmetic reasons. But the reason it works cosmetically is because it relaxes the muscles of the face that causes wrinkles. And so, if we can relax those muscles, then those wrinkles and creases will decrease in size, and the patient will no longer be able to clench or frown as hard. And then those lines start to relax. So it's the same concept that we take to the jaws of the muscles of the jaw. We relax those muscles, and they're not able to contract. And in this case, our patients do get that beautiful cosmetic effect. No one ever complains about having a slimmer jawline
Right? Oh my
as a
goodness. Hey,
result
I
of
might
doing
have to
this.
check it out myself. So if someone's interested, maybe they're like, hey, I do have some pain. Maybe I'm doing this.
Yeah.
Maybe I could benefit from one of these treatments. How would they get started?
Yeah, they can call our office for a free consultation. During that consultation, I will, of course, interview them to assess their actual needs. And we do need to rule out problems from an actual tooth. So there will probably be some x rays involved. And then I will do a muscle exam. The muscle examination is at no charge because I need to actually examine their muscles to make sure that the pain is indeed coming from a muscle. So we'll do that for them as an assessment. And then once my findings have been recorded and I've talked to the patient about my findings, we can then decide to commence Botox.
All right. Of course, you need to go to an expert like Dr. Smith. Don't do it on your own. If you want more information, you can visit smileagainnow.com. And still to come,